Hello, my name is Sarah Roten, and for this assignment, I interviewed my friend Charlie, who has type 1 diabetes and uses a biosensor or glucometer on a daily basis. During this interview, I asked her 10 interview questions about her condition and the use of her biosensor to measure her blood sugar. First, I asked Charlie about the nature of her condition, which is type 1 diabetes, which is a chronic illness. Next, I asked Charlie about when she was first diagnosed. Charlie was diagnosed when she was 9 years old, and things that led to her diagnosis were she was feeling really sick for a couple weeks before, she was taking long naps, and having to wake up at night multiple times to go to the bathroom. Her mother was very observant and noticed these symptoms and took her to the doctor, where they tested her blood sugar and it read in the 700s. I then asked Charlie how long she had been monitoring her blood sugar and how long she expects to continue monitoring it. And Charlie's been monitoring her blood sugar since she was 9 years old and expects to continue monitoring it for the rest of her life. Next, I asked Charlie to think back about when she was first diagnosed and recall any concerns or thoughts that she had about using the biosensor to monitor her blood sugar. Since she was just a kid, whenever she was diagnosed, Charlie told me that she was scared and intimidating, and it was a big learning process and life adjustment for her and her entire family. Charlie's mom really helped her learn how to use her biosensor and how to manage the disease. Even now, her mother is a huge source of support and encouragement as she deals with the chronic illness. Next, I asked Charlie about how using a biosensor has changed her life and her daily routine. Charlie says it's changed her daily routine because she must always have her diabetic supplies and her biosensor with her, especially if she's going out to eat somewhere. Charlie must take the time to check her sugar and give herself insulin if needed before meals. She also keeps snacks with her just in case her blood sugar gets too low. I then asked Charlie what all supplies are required to use her biosensor, and she gave me a list. First of all, she needs her glucometer, her test strips, her lancets, her insulin pen, and pen needles. Next, I asked Charlie about the positive and negatives of using her biosensor. She mentioned many positives, such as the glucometer helps to monitor and control her blood sugars and her diabetes. And Charlie also said that monitoring her blood sugar is a lot easier now because she's older and has been dealing with the disease for many years. She talked about how it's really nice that her new glucometer is pretty small, which makes it very portable. She can fit her glucometer and any supplies she needs in a little bag that she keeps inside of her purse. She takes it with her on the go because she lives a very busy lifestyle. The negatives are that it's just a pain to have to always check her blood sugar and always have to worry about it, and also the cost of supplies. I then asked Charlie how else having diabetes and using a biosensor has changed her life. She mentioned that it's changed her life in some obvious ways, like she has to monitor her blood sugar using her biosensor, she has to watch what she eats, and she has to go to the doctor. However, Charlie also mentioned some other ways that it's affected her life that are maybe less common or that you wouldn't think of. She stated that her immune system is compromised, so she gets sick often, and it often takes her longer time to heal than others. She also has diabetic neuropathy in her arm, which also spreads to other places in her body sometimes. Lastly, I asked her if there is anything that she would like to share with someone who is not diabetic or someone who is newly diagnosed. Someone who is newly diagnosed, she expressed the importance of taking the disease seriously and getting in good habits of taking the best care of themselves possible, which included checking blood sugars regularly, using a biosensor to help maintain good control of the condition. Charlie mentioned that it wasn't always easy for her and she hasn't always done that best in the past, and it has negatively affected her. So it's best to just form the good habits initially and stay on top of them at all times. For someone who is not diabetic, Charlie mentioned that if you have someone in your life, like a friend or a family member who is diabetic, it's a huge help to them to just learn a little bit about the disease. That way you can support them and understand what they're going through. Through my interview with Charlie, I learned a lot about biosensors and how they positively and negatively affect my friend Charlie, who's living with diabetes.